Hi guys, welcome to another episode of Healthcare in a Nutshell. Today we'll be looking at the Republic of Ghana, home of the world's most beautiful women, according to a recent survey. I had to Google that, and I saw that it was true. But anyway, let's get into this video. Ghana is located in West Africa and has a population of about 32 million people. The capital city is Accra, and its largest metropolitan area is also called Greater Accra. Ghana is well known for its democratic principles, rich culture and history, and of course its beautiful people. Like many other countries, Ghana's healthcare system has been greatly impacted by colonial rule. Initially, the focus was on building healthcare infrastructure to cater for the needs of the colonizers, rather than the locals. As with many other African nations, the colonial administration focused on preventive medicine in an attempt to limit the spread of infectious diseases such as yellow fever, smallpox, and the plague. These efforts included mass vaccination campaigns and the establishment of clinics for Europeans. However, Africans were generally not allowed to enter these facilities, except as servants. This situation only began to change after Ghana gained independence from the Dutch and British in 1957, when the government took over the management of European hospitals and began investing in healthcare infrastructure for its citizens. In 1961, the first polyclinic was established, and medical training schools were set up to educate healthcare professionals. Despite these improvements, access to healthcare remains a challenge for many Ghanaians due to factors such as geographical location, socioeconomic status, and cultural beliefs. The good news is that if you are visiting or planning to visit Ghana, you can rest assured that you will receive top-notch care should you fall ill. For Americans traveling to Ghana, your U.S. health insurance typically covers emergency medical services in Ghana. It is essential to contact your insurance provider prior to your trip to ensure that they can indeed cover you while you re-abroad, and to learn about any specific requirements. Additionally, it is advisable to purchase travel insurance that includes medical coverage for non-U.S. residents. So if you are not a U.S. citizen, then you need to make sure that you get travel insurance that covers you while in the United States. Now let's delve deeper into the country's healthcare system and how it functions. The Ghanaian healthcare system follows a two-tier structure. First tier consists of private healthcare facilities, which cater to those who can afford to pay for their services out of pocket. On the other hand, the second tier comprises public health facilities, serving citizens who lack health insurance or are unable to pay for healthcare. It's important to note that the National Health Insurance Scheme, known as NHIS, is available to all Ghanaians regardless of their employment status. This scheme helps to reduce the financial burden of healthcare and makes it more accessible to the general population. Let's start by looking at the different types of health facilities in the country. Primary health care in Ghana is delivered through a network of clinics and community-based health planning and services, HPS, compounds. These facilities provide essential healthcare services to the population, including maternal and child health care, immunization, family planning, and treatment of common illnesses. Polyclinics offer more specialized services than clinics, such as diagnostic imaging, laboratory testing, and basic surgical procedures. There are also hospitals which provide comprehensive healthcare services, including inpatient and outpatient care, as well as specialized services such as cardiology, neurology, and oncology. In addition to these facilities, traditional medicine is also widely practiced in Ghana. Traditional healers play an important role in the healthcare system, particularly in rural areas where they are often the first point of contact for people seeking medical attention. Now let's look at the human resources for health in the country. According to the World Health Organization, Ghana has a shortage of healthcare workers, particularly doctors and nurses. However, the government is investing in training more healthcare professionals and improving working conditions to address this issue. In terms of education, medical schools in Ghana offer both undergraduate and postgraduate programs, leading to degrees such as MB, BS, and MSc. Nursing training schools provide diploma and certificate programs for nurses and midwives. In terms of financing, the Ghanaian healthcare system is primarily financed through a combination of government expenditure, private health insurance, and out-of-pocket payments. The government provides funding for both the public and private sectors. While private health insurance is becoming increasingly popular among the population, out-of-pocket payments are also common, particularly for those who do not have health insurance. The major diseases that affect Ghana's population include malaria, HIV, AIDS, tuberculosis, and lower respiratory infections. The government has implemented various programs to control the spread of these diseases, such as free distribution of insecticide-treated bed nets and anti-malarial drugs. Ghana has made significant progress in reducing the incidence of communicable diseases, but there are still challenges related to access to healthcare, particularly in rural areas. Non-communicable diseases such as diabetes, hypertension, and cardiovascular diseases are also on the rise in Ghana. The government is addressing this issue through public education campaigns and the introduction of screening programs. The government of Ghana has implemented several policies and programs to improve the healthcare system. One of the key initiatives is the National Health Insurance Scheme, which aims to provide universal health coverage for all Ghanaians. Another important program is the Community-Based Health Planning and Services, which focuses on providing primary healthcare services to rural communities. The government has also invested in infrastructure development, including the construction of new hospitals and clinics to improve access to healthcare. Additionally, the government has implemented policies to promote research and innovation in the healthcare sector to enhance the quality of care and develop solutions to local health challenges. Despite these efforts, Ghana's healthcare system still faces several challenges. One of the major challenges is the shortage of healthcare workers, particularly in rural areas. This shortage leads to long waiting times, overcrowding in facilities, and limited access to specialized care. Another challenge is the high cost of healthcare, which can be a barrier to accessing timely and appropriate medical services. Additionally, there are disparities in healthcare access and quality between urban and rural areas, with rural populations often having limited access to essential services. Furthermore, the burden of communicable and non-communicable diseases continues to pose a significant challenge to the healthcare system, requiring ongoing prevention and treatment programs. Overall, Ghana's healthcare system has made significant strides since independence, but there is still work to be done to achieve universal health coverage and improve access to quality healthcare for all citizens. By addressing the challenges and building on the progress made, Ghana can continue to move towards a more robust and resilient healthcare system. Alright guys, that's it for this video. I hope you found it interesting and informative. If you did, please don't forget to like this video and subscribe so you don't miss any future videos. You can also check out my podcast channel where I discuss similar topics. If you have any questions or comments, feel free to drop them down below. I'd love to hear from you. Till next time, stay healthy.